Okay, everyone, thank you for joining us here for our weekly Wednesday media briefing. We are live with the media here on Zoom, and we're also broadcasting live on Facebook. We will begin, as always, with County Executive Marc Elrich, and Dr. Travis Gales, our County Health Officer, is also joining us as usual. Mr. County Executive, take it away.
So I just want to give you a real quick update on where we are in the COVID process and the reopening process. Probably within the last half hour or so, we released a graph showing what we think phase 2 will look like and phase 3 would look like. The highlights from that are that we're going to continue to expand childcare availability as the state does. We are going to allow fitness centers and gyms to reopen with limitations of 1 patron per 200 square feet of space. Now, this is not permitted under Governor Hogan yet, but we're anticipating that this is the direction they're going in. So I'm going to spare us both 2 press conferences. If this is where the governor goes, this is where we're prepared to go. Same with houses of worship. We're going to allow 1 congregant or family per 200 square feet of service space. We're anticipating that the limit of people in indoor and outdoor gatherings is going to go to 50, maximum of 50 people. And we're going to allow some indoor dining with requirements on space. And we will be allowing, I believe, some limited in-store retail based on 1 patron per 200 square feet. So we're beginning to make these additional steps. The date is still flexible. You know how I feel about dates. We're going to look to see what the data shows. If the data continues to be reasonable, then this is what we're going to be able to do. If we see high spikes, obviously, we won't be able to go there. But we're thinking that sometime next week, probably between the date set by Prince George's County and the date that DC said they'd do their reevaluation. So we're kind of in the same ballpark as everybody else. And that's the highlights from phase 2.
All right, thank you, sir. In the interest of time, and Dr. Gales has a public health officers meeting at about 12:40. He's got to go. So just for the reporters on the line, if you have something specific to public health, please get that in on the chat and we'll call on you. For right now, Chris Gordon has a question for the county executive. Chris, hang on a sec. They've got to unmute you.
Am I unmuted?
Yes, sir.
Okay. Well, today you have the opening of the Bethesda Streetery with a number of restaurants serving in streets that are closed. If you'll tell me, are you anticipating expanding this to other areas, Rockville, Silver Spring, Germantown, Gaithersburg?
Yeah, this is going to pop up all over the county. You know, we've let them know that if they want to do outdoor seating in parking lots, they can go ahead and do that. Normally, this could involve a typical process of complicated regulations and stuff, and we've just said if you want to use the outdoor parking lots, they're able to do that. That's easy for them to do. It's not county property. We're looking at closing streets in other parts of the county to accomplish the same thing. We want to make sure that everybody can be able to get some options in outdoor dining wherever they live in the county.
Thank you.
Tom with Fox 5. Hang on a sec. Let's make sure we get you unmuted and Chris muted. Good to go.
Okay, thank you. Thank you for doing the call. This is a question for both the county executive and Dr. Gales. A lot of us have been covering the social justice protests over the last couple of days in our region. And as you know, Dr. Fauci and the Centers for Disease Control have voiced concerns about a spike in COVID-19, especially amongst people who have attended these rallies. Clearly, our region has been at the center of that is there a scenario which you could imagine and any metrics as to you having to roll back the phases and having to reverse the openings that you've announced so far or plan to announce next week?
I mean, I'll let Travis answer that mostly. I mean, what we're hoping is we don't see a spike. I mean, if you look at our data, you know, and compare our charts with other cities that had really bad cases, you know, you see this long upsloping line that gets really steep in other places. Ours kind of started going up and then we were able to level it off. But we're trying to stop as a resumption of that curve, because that would put our hospital capacity or medical capacity in general at risk. So we're hoping we don't see that. And, you know, I was at a couple of demonstrations. I saw what people were doing. Largely people were wearing masks and or face coverings, I should say. And I'm hopeful that doing that minimizes whatever negative impact there is from this. I'll let Dr. Gales.
What I'd like to say is we've been very clear from the beginning that if at any of our stages, regardless of any activity that may be, an uptick of cases may be attributed to, that we would continue to evaluate the status of our metrics. And if we saw an increase in cases or a significant increase in any of those metrics, that would give us pause and give us reason to go back and reevaluate where we are and potentially go back in terms of reenacting some of those restrictions. And so that is a policy that we've taken from the very beginning, not specific to the gatherings that have happened recently related to social justice. And so I just want to make sure that folks understand that we will always continue to use that as a guiding post. Now, certainly we do, you know, much like other jurisdictions, are we made sure to give advice to folks if they were going to participate in gatherings. Here are some things that you should do to minimize the risk of transmission and to protect yourself. I think we talked about that on last week's call to provide some of that guidance. And so we'll continue to see, but we will look at the totality of the numbers in the context of where we are, because what's interesting, we also are seeing in other places across the country an uptick in cases that have not been attributable to large gatherings, because we've seen the impact from 10 to 14 days before, and that could be attributable to reopening too quickly or too liberally, that may cause that. So I say all that to say that we're looking at all of those different factors, and we'll continue to look at the data. And if we do see an increase in cases or an increase in those metrics, we would have to reevaluate where we are.
Thank you, Dr. Gales. Before we get to Rebecca Tan from the Washington Post, I just wanted to make 2 points. If you're just joining us on Facebook Live, or if you're actually on this Zoom call, for all of the reporters joining us on the Zoom, the news about our plans to move to phase 2 reopening was tweeted this morning from the county executive's account, and that is MARC_ELRICH. And the Montgomery County government Twitter account also shared this news about the plans for phase 2 reopening. Reporters, if you've got a question, please put it into the chat box and we'll take you in the order in which those questions come in. And Rebecca Tan from the Post is up next.
Hi, thank you both for doing this. A small related question for Dr. Gales and then a question for County Executive Marc Elrich. The first, I just want to clarify. So there's no evidence yet that the large gatherings, the protests have led to a spike in cases. I'm wondering if you could clarify on that. And the second thing is, this past Tuesday, Montgomery County Council members declared racism a public health emergency. I'm wondering if both Dr. Gales and County Executive Marc Elrich could say if there's anything from a health standpoint, a public health standpoint, that the county is planning to do to address racial inequities, racism. I know the county has done things before, but I'm wondering if there's anything new, any changes that you guys would like to telegraph and announce to residents and constituents who I know are very concerned about this matter right now.
Sure. Well, I'll take the first question in terms of the impact of large gatherings. So as we've talked about before, it can take anywhere from as little as 2 to 4 days for an individual to develop symptoms, upwards of 10 to 14 days. So the impact of a particular exposure and event it can take up to 2 weeks to really get a true sense of the impact of exposure. So the short answer is we'll have to continue to follow over the next several days and the next week to see if we do see any rise in cases and potentially attributable to large gathering activities. Based upon what we have seen so far, as we've actually, for our jurisdiction, have continued to see a downward trend of new cases. Now, the last 2 days we've had over 100, but before that we had one day of 84 and the previous day at 110. So the key will be is if we see what do those numbers look like over the next week, to take that into consideration. But where we are now, we've continued to see improvement in our new cases, and the 3-day averages that we've been using as a part of our metrics have continued to trend downward. That is also in the setting of increased testing. We have tested more residents of our jurisdiction than any other jurisdiction across the state. We've tested over 68,000 residents, which is approximately 6.5% of our population. We have completed over 76,000 tests, and our 7-day average for test positivity is actually now at 9.5%, which is significantly lower than where we were at the height, or at least the first height, over 30% in terms of test positivity. Now, as it relates to shift a little bit to the question of public racism as a public health issue, you are right. The county has done a lot of work, both in the public health space and on the legislative space, in terms of looking at racial equity as a social justice issue. Within the public health space, we have prioritized using data to tell a different story. And so we've put out a number of reports that talk about race, talk about geography, talk about gender, talk about health disparities and inequities across the county to help our elected officials and policymakers to help advise that process. So that will continue to be a priority. We have also utilized an approach of health in all policies, which really targets looking at social determinants of health and the impact that they have on health outcomes. And we've provided education to all of the departments across county government to help them understand the impact of their related decisions and their policy areas on health outcomes. Now, one of the other things that we're doing right now is pulling all of those old toolbox issues or tools in our toolbox to be able to highlight those areas where we've seen the most cases. So our epidemiology team has identified the zip codes where we've seen the most cases and are looking across. So not only what do those zip codes look like as it relates to COVID-related illnesses and deaths, but we had a previous report looking at zip codes about 1.5 years ago. So what do those zip codes look like in terms of education, socioeconomic status, health outcomes, access to care, and chronic disease burden? And what we have found is that many of those same zip codes don't score as high on good health outcomes. And so as a result, we are working with everyone from our chief equity officer to county council to the executive branch to develop strategies that are not only addressing the short-term issue in terms of COVID-19, so making sure we have enhanced testing, very specific partnering with agencies within those zip codes to do more effective, robust contact tracing, but also thinking about what are the long-term systemic strategies that need to be put into place to improve the overall health outcomes of those communities so that they are not predisposed to having adverse outcomes or more COVID-related outcomes if this happens in the future.
Mr. County Executive, did you want to touch on that?
Yeah, I'll touch on, I guess, the more governmental social service side of this. First of all, thank you for that question. And it's pretty open-ended, and I'll treat it as an open-ended question. I'm glad the council's acting the way they are. I'm sure this is going to pass 9-0. I think that there are things we absolutely have to change. At my direction, I had asked the police department to bring in an outside resource for reevaluating everything about Montgomery County Police, from the hiring practices, recruitment, to this officer discipline, and all the rules that govern the police department. And we will be bringing forth a contract and maybe some options to the council for approval, but we were working on this going back to when Marcus first came on the department. In addition, we've had a task force working on decriminalizing homelessness. And so this will be the opportunity for us to bring their work forward to look at what we can do to decriminalize homelessness. If you know anything about what happens to homeless people, they just get caught in the vicious cycle of, you know, one violation and the rest after another. Because they're homeless, they don't get notification of trial dates, then they're cited for failure to appear, and then they're arrested when somebody runs their name. We want to put an end to that stuff, and this ought to create the climate where we can actually put an end to that stuff. We, are looking at reforms in the police department directly in terms of, use of force regulations, the duty to intervene, which is, I think, really important. But I got to say, when it comes to police, we all focus on the actions of individuals, but these individuals in these departments have been trained to do a lot of the things that people find problematic. So when people talk about over-policing, they talk about the harassment of young Black kids, to see if you can find pot on them. That didn't come from the officers, that came from the top. When people talk about protectional stops, where you make up a reason to pull somebody over, and then you ask them a question like, you don't have a body in your car. And then the person says, of course I don't have a body in the car. And then the officer says, well, then you wouldn't mind if I searched your trunk. All this kind of questioning, which is intended and disproportionately falls on people of color, that did not originate with the officers. And if you saw one of the tapes from that was shown in a Montgomery County incident, it was leadership, a supervisor that was directing the officer how to question the driver of the car. So it seems like an officer problem. I assure you, this is an institutional problem. They do largely what they're told. They're not told to be excessively violent. When people get out of hand, they get out of hand, and we are going to deal with that. But if we're going to fix this, this starts top down in terms of what we direct our officers to do, whether we promote officers and reward officers for how many tickets you write rather than how many community meetings you go to. These are all things that we're going to get to and address. Another topic which is near and dear to my heart is housing. When I came in, I said I wanted to shift housing in Montgomery County from rental housing to ownership housing. I can't tell you that this is not an easy thing to get the nonprofits to accept, because historically, they own the rental housing. If you're going to build wealth in the minority community, the only way you're going to build it is by giving people opportunities to own property. If we're going to continue to provide rental property and think that we're doing people a favor, yeah, I might be lessening the rent burden or controlling the rent burden over a period of years. But am I addressing the fundamental issue of being able to build wealth, be able to take out a second mortgage so your kid can go to college, or give your kid a down payment for their house when they need to buy a house? The things that we've done and the way our housing programs have been focused, and it's not just Montgomery County, this is national and needs to be refocused on ownership. And I will say, I've always viewed the emphasis on producing rental housing by nonprofits is pretty paternalistic, because underlying that is a notion that poor people can't manage their own affairs. Because I could just as easily take what's a rental building and turn it into a condo building and give people the opportunity to own it and benefit from ownership. And that's not a decision that's been made. And I'm looking forward to this being the opening to say, if we're really serious about building wealth and dealing with the underlying causes of racism, here's cause number one, and here's an opportunity to do something about it.
Thank you, Mr. County Executive. Dr. Gales is going to have to leave very shortly, so Randy Bass has a question for each of our speakers. Randy, why don't you direct that to Dr. Gales?
Certainly, and thank you for having us on the call today. Quick question. When it comes to the county's ongoing response to COVID and moving into another phase, what lessons have we learned from public health crises and pandemics of the past? How are those lessons being applied to our COVID-19 response and influencing our decisions today?
Sure. Good afternoon, Randy. That's a great question. We could probably have a press briefing on that for hours to talk about best practices. as there hasn't been a guidebook for any of this in terms of the large scale of what we've asked communities to do. And what our agencies have had to do for such a sustained period of time, at least in any of our lifetimes. I think some of the big take-home points, just briefly, is to continue to utilize resources, study other jurisdictions, reach out to individuals to find and identify best practices. For example, we have created a public health advisory board or advisory group to provide guidance to the health officer and our public health team in terms of the metrics that we're looking at to reopen. Are we looking at the right things? What other things do we need to be looking into to make sure that we can maximize the safety of our residents, both in the short-term setting as well as long-term, because we want to make sure that the work that we're doing is implementing strategies that are going to be impactful and keep us safe for a long time. And so we recognize we're not the experts on everything. We have lots of staff who have great expertise and knowledge, but we're reaching out again and looking at other places to learn from them in terms of how we can improve what we're doing. So I think that's a big answer. I think part of the other challenge is some of the lessons that we've learned, we honestly are doing the best we can. So for example, with a new outbreak and a new pandemic, you're constantly learning new information. For example, I think back to the whole, all of the data in the very beginning recommended that the majority of cases were related to travel. Well, it would have been great if we could test everybody that wasn't specific to a very narrow travel history. And within that, our testing capacity was significantly limited. So we weren't able to do broad-based testing to factor in community transmission, which at this point has caused this overwhelming majority of the cases that we have. Similarly, I think another thing that we learned, and we will be able to move forward on next time, is that asymptomatic individuals do transmit. And I say that because that received a lot of controversy yesterday with the World Health Organization's or 2 days ago, their comments that they've since walked back. And I think as of this morning, Dr. Fauci addressed that and said that the comments were not accurate, that asymptomatic individuals can and have, in fact, transmitted the virus to other individuals. Because as you know, for a long time, the guidance recommended that those individuals did not, and as a result, our provisions and our investigations did not factor that into consideration. The minute we found out, obviously that changed. Now we have face covering mandates in place, as well as that being an important component of our contact tracing investigations, knowing that the period within which an individual is infectious goes beyond just when they develop symptoms. So those are a couple of things that I think that we have learned already and have implemented and used to guide our process as we move forward. And the hope is that it's less about necessarily getting it right immediately. It's more along the lines of when we find out that information, being transparent and reporting that to the community and adjusting and tailoring our response accordingly as quickly as possible.
Thank you, Dr. Gales. Any chance we can keep you for a minute or two longer or no?
I got a minute. I do have to shift over. So if there's another question, happy to answer.
Okay, Randy, hang on for us for 1 second. I want to make sure that Kate Ryan, who does have a question, I want to see if that's for Dr. Gales, so to let her ask it now before he has to leave.
Thank you. Yes, can you hear me?
Yes.
Yes.
Okay. Quickly, you mentioned the demonstrations, some of them very large scale, some of them smaller scale. Many of the people attending would be those who might be most at risk for contracting COVID-19. Are you recommending that people who went out to attend these large gatherings get themselves tested?
Well, sure. I mean, I think that's, at this point, so I want to clarify something that you said. The folks going aren't necessarily more at risk of contracting COVID-19. So it's very clear right now, all of us are susceptible to contracting COVID-19 if we're exposed. Where we see significant disparities is we do see disparities in terms of cases hitting certain communities. And that's more in terms of, their living situations, being essential employees, those kinds of things, less in terms of race. The challenge is when we see, we continue to see disparate outcomes in terms of the severity of the illness and particularly fatality rates. And so those things are more closely tied to race and ethnicity. And so I think all right, to reframe your question, I think we do see folks who going to the protests who may be disproportionately impacted if they do contract it. So what we would say is this, consistent with any situation, if you have been in an area where you think you may have come into contact or are concerned for an exposure, we would recommend you get tested. We have a host of different testing options in the county, both that are provided by the county as well as through your healthcare provider. And one of the great things, and this actually goes back to the question, the previous question, one of the best practices is that testing criteria now includes a category for asymptomatic individuals to be considered. So within that, it's anyone who has a known contact or, an activity where social distancing may have been difficult to sustain and maintain, such as being in a large gathering setting.
Okay, Dr. Gales, thank you so much for staying a little beyond where you needed to go. We appreciate you joining us. And for the county executive, we've got about 10 minutes left. Randy, I believe you had a question for the county executive. Thank you for holding on so that Kate could get hers in for Dr. Gales.
Sure, of course, no problem. I wanted to open that same question that I addressed to Dr. Gales at first to the county executive also, just kind of asking about how prior public health crises, pandemics, things of the like have influenced our current response and our decisions going forward.
Well, not being a medical professional or somebody who's had to marshal medical resources, this is a little bit, a hard question for me to answer because, we've dealt with a couple of things, but I can't think of anything in my lifetime that is vaguely similar to this. I mean, I grew up in the era of polio. I kind of grew up at the end of the polio world when the vaccine became available, I think in 1955 or 1956. I read articles about how people didn't let their kids go outside and play during the summer and all this other stuff. I didn't know that as a kid. I was thinking back on this and all I knew is we were getting vaccinated. I had no idea what was going on in the world and how bad it was. I just knew they had a vaccine. So, looking at that, people apparently took precautions against polio, and it wasn't an unusual thing. Apparently, it was more of a normal thing for people to do. They were very worried about the spread of polio. And of course, you read about the flu of 1917, and again, it's cautionary. But today we've have in some ways we're able to more quickly identify the cause and identify possible future treatments than they were in the past. I will say that one thing that's really clear on this is the government should have been better prepared. They should have not ignored the advice of the committee they had that was set up to look at pandemics and viruses. That was a serious mistake. And I think in general, one of the things I told our folks to do was to stockpile all of the personal protective equipment, all the things, masks, sanitizer, whatever, so that when the virus comes back, which everybody says it's likely to do, we're not looking for supply, we have the supply on hand. And I would anticipate, given what we know about scientists talking to us about new viruses or things being unleashed from the thawing of the permafrost and things human beings haven't seen in 10,000 years and maybe longer, it might be wise for all of us to maintain stockpiles of just basic supplies. So at the very beginning of something, at least you're able to say, here's a face covering, we've got gloves and masks and sanitizers, and let the scientists do their work on how they're gonna ultimately cure or treat these things, but not leave everybody so vulnerable that you're rationing stuff. It was sort of like we were with rationing test kits, where Travis's comments about what the policy was on testing had nothing to do with what you would do if you had abundant test kits. It had everything to do with how do you prioritize testing in a world of scarce test kits. It would be good to have the right supply of things on hand so you're not making rationing decisions and leaving some people exposed because other people are more at risk. We should do a better job, and that's one of my intentions, is to make sure that we're building that supply of the things we need right now. And it's why we've got a testing contract for a year.
Thank you, Mr. County Executive. I just want to point out that Earl Stoddard, who is Dr. Earl Stoddard, who is our Director of the Office of Emergency Management and Homeland Security, is on the line. If any reporters have any recovery-related questions, he is available to help answer those. Kate Ryan from WTOP had a follow-up question regarding financial impacts. Kate?
That's correct. I know that at the beginning of this, we were looking at the financial hit that every county was facing. With the reopening or moving towards phase 2, do you have an idea of how that's being minimized? Or like, okay, if we can get these businesses open, we'll have X amount of dollars pumped into the economy. Does anyone know that? Is there any way to gauge that?
I don't think there's any direct way to gauge it. I mean, what you're looking at is businesses may reopen, but if, for example, if you did curbside delivery, you're not probably fully adding new or bringing back all your staff to do curbside delivery because there's not much customer service in the store and the volume of sales is relatively low. Same thing with outdoor dining. So I expect as things start to ramp up, we should see a restoration of some employment numbers. But, you know, the biggest concern is the people who aren't going to reopen. There are thousands of businesses that have probably permanently shuttered. I think I saw a story today that nationally they're expecting 25,000 businesses. And I think this includes chains, which means multiple businesses to shut down. So those are going to be hard to bring back. And there's the unknown effect of what landlords are going to do with the tenants who couldn't pay rent for at least April and May and probably June. If they didn't have incomes, there are a lot of folks who aren't going to be able to pay that rent, and it's going to be a question of whether these landlords are willing to either just write that off because the businesses had no choice, or whether they're willing to come up with reasonable payment plans that a business can say, well, I can pay this back over the next 3 years, or I can extend my lease by 3 months. But I've talked to businesses who are very worried about somebody saying, you owe me 3 months rent. I know businesses have already gotten letters about how they're going to be evicted and that I expect you to pay no matter what else is happening. And if that's the approach that some of these landlords are going to take, it's going to be really difficult. But of course, beyond the landlord is the financial institution which holds the landlord's mortgage. And this is, in my mind, this is a place where everybody has to take some kind of hit. If the banks insist on mortgage payments, landlords are pretty much going to insist on rent payments. And there's got to be an understanding that this needs to be worked out across all sectors, because if they don't do this, you're going to wind up with a lot of empty retail space, and the other side of that is much higher unemployment than needs to be. I'm a believer that if we had the willpower, we could speed up the economic recovery of this country just by doing what it takes to move forward from this day as if the past happened and now we're going forward and we're not going to make people pay for all the damage that was done in the past. But to the extent that people expect to get made whole for what happened in the past, I think it endangers the ability to recover in general.
Kate, you've got a quick follow-up, and then Tom from Fox 5.
That's correct. In terms of minimum wage, some small business owners would like to see the minimum wage frozen. There are others who are saying if you do that, it makes recovery for the person receiving the minimum wage much tougher. Do you have a thought on that?
I'd rather not freeze it, but that's discussion I'm sure people are going to want to have. I don't think it's terribly helpful. It reduces buying power. It has economic negatives attached to it. But I understand people's concerns, and I'm sure it'll get discussed.
Tom, Channel 5.
Thank you, County Executive. I was not on the call last week, so I haven't had a chance to ask you about this. 2 weeks ago when we were in Kentlands, I'm sure you remember, it was a very emotional afternoon. You took a lot of heat from the people that were there. A lot of them were angry. They were outspoken. You engaged in a very vigorous back and forth with them. and I haven't had a chance to ask you about this. 2 weeks later now, has that impacted, influenced, informed any of the decisions that you've made as you move now into phase 2? And what do you think happened that day from your side of the lectern, County Executive?
Well, I mean, I thought it was kind of an ugly demonstration. You know, that was ironic because I was talking about reopening, which is the very thing that they've been most vexed about. And I thought they would have wanted to hear that. And I thought they would have wanted other residents to hear that, but that apparently wasn't what they were interested in. I was fascinated by the interview with one of those people who was at that demonstration in Bethesda Beat yesterday, who apparently thinks this is some fiendish communist socialist conspiracy. I'm not sure to what end they think this gets us. I mean, as a government official with admittedly somewhat liberal leanings, I need businesses to be open because I need employees working and I need businesses paying taxes so you can provide the services that this county needs. This is just a fundamental issue of how you restore economic health. So we didn't do any of this in order to cause economic damage, which is what they assume. We did this to keep people from dying. And I hate, weighing the cost of a death versus the impact on the business. I'm always brought back to when I was growing up, when Ford engineers calculated the cost of lawsuits to Ford for the Pintos that blew up versus the profits to Ford from selling the Pinto. I don't believe in trading human life against money. I just think it's a bad bargain. So we made really hard decisions. That protest didn't influence what we're doing because we've always said as conditions improve, we continue to open up. And that's exactly what we're doing now. We've gotten an improvement in conditions. We think we can open up. Hopefully there's no spike that's unexpected, but tomorrow will probably tell us that because sometimes there's a delay in reporting of testing from the weekend. And that's probably what we saw in some of the earlier weeks with spikes. This week we've got a spike, but the spike is much lower. It's not 300 people, it's 150 versus days of near 100 or 100 or less. So we're still focused on what we intended to do. I mean, I continue to take my guidance from my health officer. My health officer is actually a state employee. That's where we're focused. That's where I'm going to stay focused.
Okay, and last question of the day is coming from Brianna. It is for Dr. Stoddard. Brianna's with Bethesda Beat.
Yes, hi, Dr. Stoddard. Could you give us an update on the contract with Advogenics? I know that Dr. Gale said yesterday that you all are still working to try to get those online. And initially, you all had announced that starting June 8th, which was Monday, it was supposed to boost to 20,000 per week. So could you give us an update on where those stand?
Sure. So making great progress with Advogenics. And actually, I know the county executives had conversations with their CEO this week, so he may have even better information than I. But we did do a pilot test with some employees last Friday to make sure that the system that we have is up and operating. And the test was a success. And so we are moving forward this week with the first round of testing likely to occur. And then we'll expand out to additional tests and additional venues. I know I'll echo Dr. Gales because he's provided this update to us several times. We're also about to launch our pop-up testing avenues, which will be sort of in the community, will not require a referral, and we'll move around the county to areas, particularly targeted areas. And I think he said this aligns with our strategy to be very active in addressing increased testing in areas, particularly where we are seeing higher numbers of cases. We've talked about the 209, 02, 04, and 06 zip codes many times. There are others where we have a higher number of cases, and we'll target those pop-up testing opportunities there. And so, yes, the Advogenics contract is expanding. A lot of what the work has been done has been on the data entry portion of it, because obviously, Administering the test is one thing, but making sure you can link it back to the patient is a big thing as well.
Mr. County Executive, did you want to add anything to what Dr. Stoddard said?
Look, I think what Dr. Stoddard ended on is the thing that we had to resolve was how do we input the data fast enough at the volume we were intended to input the data, and how do we make sure it connected both to the state system and also got information back to residents. I've talked with the company several times, and everybody's been very anxious to get this worked out so it's a smooth process, and so that we're not handing pieces of paper back and forth and unable to report the data to the state. So my understanding is that those issues have been resolved in the way they needed to be resolved. Sometimes it's ironic that you get the test handed to you and then you discover that you've got a software glitch. But that's life.
All right, well, thank you everyone so much for joining us today. The entire briefing is available on Facebook, and we will see you again here next Wednesday, if not sooner. Take care, be healthy.
Thank you.